I think that is a very good question. The thing is, if you have a vaccine-preventable disease, what you do is you vaccinate people with an expensive, mostly expensive vaccine. And then, of course, you need to know what is happening if the vaccine is really working. Otherwise, you invest a lot of money with the state and you don't know if it gives any result. So ideally, what you do is you try to figure out how much disease burden you have before you start your vaccination. And then, after you start vaccination, you watch if your disease burden goes down while doing the vaccination. That, of course, means that you have to find ways to find out how much disease you have, and that is what we call surveillance. And ideally, surveillance starts before your intervention, before vaccination, and continues in an unchanged way during and after the vaccination. And then you can see exactly what the changes are in your disease and whether your vaccination is effective. You can actually even calculate the effectiveness of the vaccine. Yes, well, this is my second time I'm at this Middle East conference, and first of all, I was excited to be re-invited. And I think it is very, very important, first of all, that we make vaccination accessible to everybody and every child in the world, but also that we, from countries where we have surveillance, help people in other countries to set up surveillance, and we try to give them advice if they need it. And the other way around, I learn a lot here of difficulties that we do not have in Germany, for example, but difficulties that are specific to these Middle Eastern countries. And I think if we work with each other and we work together, we come to a better result. And as you know, disease is not bound to a country. Most of our pathogens travel worldwide. Influenza goes all around the world. So it's also in the interest of us that vaccination in the Middle East is done well. And in the Middle East, it's important that the rest of the world vaccinates well. So we are all fighting the same enemy, so to say. And I think it's the most challenging thing as a scientist is to work with people from all kinds of different settings and countries. And looking at these two conferences, I'm always impressed by the amount of people that are there and the interactive nature of the meeting, the questions people ask. And I always come home with new insights and new contacts, and mostly this results in contacts that last longer and in projects that help to get better surveillance and to get better understanding of disease.